In anti-aging surgeries, the right time for the procedure is when the patient starts to feel the effects of aging, when sagging begins to appear, of course. But when it comes to surgeries performed on younger patients, especially the contouring procedures you do like chin bone and maxillary structural surgeries, we see these are becoming quite popular. Yes, surgeries can also be performed on younger patients who want to change their facial shape to achieve a more attractive, more defined appearance. And there's also what's popularly called the fox eyes or temporal lift procedure, which is a bit different. In these cases, we perform endoscopic techniques on patients who don't have sagging skin, but simply want a more lifted and appealing facial expression. Fox eyes, cat eyes, almond eyes, these are the common names, but the actual term is temporal lift, often combined with brow lift and forehead lift procedures. The goal here is to give the upper face a more attractive, lifted, and energetic look, and these procedures can also be incorporated into other facial surgeries. Doctor, you are well known for your endoscopic approach and techniques. Onep Clinic performs many facelift surgeries, and a large part of them include endoscopic methods. There's one surgery we often discuss with you. You've mentioned that you don't generally prefer traditional upper and lower eyelid surgeries, right? Yes, we do perform eyelid surgery when necessary, but our approach is a bit different. On the upper eyelid, if there is excess skin or drooping, we definitely remove it, that's essential. However, on the lower eyelid, if there's mild puffiness or excess skin, we don't rush to remove it. Instead, we lift the midface area first and then address the lower eyelid if needed. Here's why the main cause of most lower eyelid problems is the descent of the midface. As the midface drops, it creates the appearance of bags or sagging under the eyes. Instead of cutting the lower eyelid directly, we correct the midface position without making an incision under the eye, which naturally resolves the majority of those issues. After about 3 months, once the healing process is complete, if there's still a little excess skin, we can remove just a thin layer of skin, but most of the time, it's unnecessary. Since we treat the underlying problem by lifting the midface, we rarely need to perform traditional lower eyelid surgery.